So we're going to take a very brief moment to discuss the difference between what would be called a full diagnosis, or you could term a full diagnosis before any treatment is applied, and what you could term concurrent diagnosis and treatment. Some may call it a running diagnosis and treatment. So you've seen me go through a general algorithm many times that I've created that seems to be working for myself. I know the tests that I purposefully leave out, such that I know what I'm not testing specifically, such that if I don't have a particular finding, or I need to go from macro to micro and I need to differentiate between things, I can add those tests in. So again, it's very purposeful that some are left out, because my general assessment lets me get through the whole body very quickly, identify areas of concern, and then pay attention to them. But as a contrast to that, essentially a concurrent assessment and treatment would, and I'll use something somewhat similar to what I usually do to start to show this. So we'll have you bend to your left and bend to your right. Okay, so we see good right side bending compared to not necessarily good left side bending. So I would have to immediately, if I was going to do concurrent assessment and treatment, address that. So I'm going to immediately go after that finding. Now, because I didn't get any signs of pain particularly, then what I would do is I would ask the patient to bend left, so I would go direct. So no pain, I would choose to go direct, and then I would do something like this. So I can hold, essentially you're waiting, you could be doing MFR, you could articulate, kind of bounce in and out, something like that. Then what I would do, should that have been successful, we would then bend to the left and it would look farther, we would bend to the right, there you go. So that would be when I immediately find something, I do something about it. Another example would be turn your head to the left, good, and turn your head to the right. Okay, so not as good to the right. We'll pretend that there was some pain there, so I would have to choose to go indirect. Right? I would have the patient turn the head to the left just gently until I felt softening in the tissues. I would control, right? So I come nice and tight to the patient, lots of control here. I'm going to go until I find some softness in the tissues. So you'll see that it's not absolutely the direction of the direction of preference, right? So it's not just the direction of the diagnosis. I'm going until the soft tissue turns soft. I'm going in multiple ways, right? Small movements. Then essentially I can't really create traction here, but those micro movements are going to be your compression, torsion, and shears, right? So not a lot of shear through the neck, it's not intelligent, but your torsion, your compression, right? Squishing the head. So then what I would do, should that have magically worked, right? So I chose to go indirect. We'll pretend that magically worked. Look to your left, and then look to your right, and magically he goes farther. That would be concurrent assessment and treatment. So as you're assessing, you find something and you immediately apply treatment to it. Now, that is not something that I necessarily advocate for, because you may end up doing a lot of work that is not required, right? When you do a full assessment, so when you use the concepts that I've put forth, macro identifies micro, so a large movement is made up of smaller pieces, and you're able to identify, usually visually, the smaller area of the problem, preferably patient active before patient passive, and being organized in your approach. You have an organized approach. You find the areas that are of most concern, or the only areas of concern, depending on the situation. You treat those, and you retest in the same way that you retested. Then you're not spending your time essentially catching up to everything that shows itself. There may be a lot of work that does not necessarily need to be done if you're being very minute in each test that you do and treating something with most of them. So if you were to perform a test and you really didn't find anything, then you don't do anything with concurrent assessment and treatment. However, you have a lot of work ahead of you, because depending on how you set yourself up, you may choose to check a lot of things. Therefore, you may have to treat a lot of things, because you'll always be convinced that there's something wrong with them. Whereas if you do a broad assessment, identify the areas of concern, and just treat those as minimally as possible, retest them the same way that you found them, you can stage yourself much more tactically. You can identify the problem with one test, you can treat it in its most appropriate position, and then retest it. So when you find multiple things, we've already gone over that, how to make those choices depending on what you find. You put the patient in the position that's most advantageous to both findings or all three findings, or you choose the largest problem first, treat that most advantageous position, then move on, then you run your tests again. Should you need to go after it again, you're completely able to. That way you're more pointed, you're more organized in your assessment and your treatment versus constantly playing catch up. Now, are there times when concurrent assessment and treatment are quite good? Yes, definitely. One of those times, because you're not going to spend as much time assessing a lot of things, would be an acute patient. They come in, they have a very, very acute pain, they are able to identify it for you, you check their motion, it's just not going to do much of anything. Basically apply treatment to reduce or soften tissues, right? So essentially going indirect, make the soft tissue soft, hopefully reduce pain, identify that to the best of your ability, and then you would move on, right? So in acute situations, concurrent assessment and treatment is usually more appropriate. You have far less things to do. Whereas a person who is more in a chronic situation, you have to identify what's going on, do the big stuff, and move on.